Child, early or forced marriage. What acts or situations constitute the presence of the risk? Child marriage refers to any formal or informal union where at least one of the parties is under the age of 18. It is inherently a form of forced marriage, as children are not able to provide full, free, and informed consent. This harmful practice may be deeply rooted in tradition or used as a survival strategy, particularly in times of crisis. Families may see child marriage as a way to reduce economic burden, ensure perceived safety, or secure social status. In some cases, girls are forcibly married after being kidnapped by armed groups. Boys may also be affected, though the practice disproportionately impacts girls. In all its forms, child marriage denies children their rights and exposes them to increased risks of abuse, early pregnancy, school dropout, and long-term harm to their health and development. What factors must be identified for monitoring? Child marriage is a form of gender-based violence with serious health, educational, and economic consequences. Girls who marry before the age of 18 are more likely to experience domestic violence, pregnancy-related complications, and reduced access to education. These risks can lead to poorer health and economic outcomes, both for the girls themselves and for their future children. Over time, this compounds intergenerational poverty and weakens community resilience to future crises. Monitoring must assess both the scope of the problem and the conditions that drive it, such as poverty, food insecurity, or lack of access to education. It's also critical to examine the roles of state and non-state actors, particularly in areas where authorities fail to prevent or even perpetuate the risk. Understanding these factors helps guide targeted prevention, protection, and accountability efforts. What information and data can illustrate the presence of the risk? Identifying the drivers of child marriage, such as safety concerns, food insecurity, or social norms, is a crucial first step in understanding and addressing the risk. Once these drivers are known, location-specific data can help identify where risks are highest. Key data sources include the GBV Information Management System, GBV-IMS, Security Council MRM reports on grave violations, National Census data, UNICEF country profiles, household surveys, key informant interviews, and focus group discussions. These tools offer valuable insights into both prevalence and underlying causes. However, percentages from households assessment, key informant interviews, focus groups discussions should be interpreted carefully, as they reflect the views of the respondents, not representative statistics of the broader population.